contrast barium enema, which most of the time it will be, in addition to the views that I just demonstrated, you're also going to be doing a left lateral decubitus and a right lateral decubitus and a PA cross table rectum. So I'm going to demonstrate those. I'm not going to go as fast this time because he's tolerating the barium very well. All right.
No, I'm not.
Okay, so we're going to take 3 more images on you. First, I need you to roll toward me onto your right side. Okay, and then what I need you to do is slide yourself back until you're at the back edge of the table and your shoulders as well. Okay, good. Now you are close to the edge, so please don't lean back. Okay, I would have a gridded cassette ready to go, and I'm going to be going under the pad. A lot of times during the barium enema, there won't be a sheet or anything on the table because you know, the patient's going to be rolling around a lot and they tend to just get tangled up in the sheet. But for the demonstration, I left the pad on for the patient. Okay, bring both hands up by your face, up kind of high. Bring your elbows up. There you go. And push on your side. Again, I'm feeling for crest, and I'm going to center a little bit higher for this because I want to be sure that I get the splenic flexure, which is right up under the diaphragm. Even if I miss the sigmoid section, that's okay because we'll get that on another overhead. So right now I'm about 2 inches above, which is the same as you would center for a decube of the abdomen. Okay, once I'm ready to go, this time his left side is up, so I'll just use this one. I'm going to use my left marker. And we'll set it for a horizontal beam. Not working on this tube, I'm going to estimate 40 inches with my shoulder at the middle of the tube, my arm extended. I know that I'm a little short of 40 inches, and so this is about the right distance. I'm going to make sure that I'm centered to the IR, centered to his mid-sagittal plane, and then open up my field of view to the size of the IR, so you should not see any light on the wall. And make sure that his body is in the field of view. All right, so I would do my AP right lateral decube like this, with him holding breath at expiration. And then I'm going to do a left lateral decube. All right, sir, slide away from me on the table just a little bit. Turn to your back. And then roll up on your other side facing me. This time your stomach's going to be up against the plate. Okay, come forward with your shoulders just a little bit more. There we go. Okay, feeling for crest again. My center is going to be a couple inches above crest. Okay, looks good. This time my right marker will be showing because his left side is down, his right side is up. And my centering still looks pretty good. Okay, I would do another hold breath on expiration. Okay. All right, we've got one more now. Just, I need you to go ahead and slide away from me. Stay on your side, but go back toward the middle of the table. A little bit more. All right, now roll all the way onto your stomach and bring your hands up by you on the pillow. There you go. Now, during this whole procedure, you're going to have to make sure that the enema tip and tube does not get tangled around the legs, so that's something that you also need to keep an eye on. And then for the lateral rectum, okay, slide toward me just a little bit. There we go. Okay. If this is crest, I know that that's L4, L5, S1, and the rectum is right under the sacrum. So I'm a little too low. I would probably be centered about 3 inches below the iliac crest. I would place a right marker here because his right side is closest to, and we're really close on this, but as far as the sigmoid and rectum, it goes anterior, it goes from posterior to anterior, so I should be able to include all of the anatomy on inside the field of view. So I'm going to center to the IR. My collimation is now down to a 10 by 12. Okay. And if you had a larger patient, you could always go to a 14 by 17 IR and just collimate down, but he's, I believe, going to fit on here. Actually, I look a little bit high. I don't want to be all the way up at his crest because that's I want to be centered about maybe 4 to 5 inches below based on his anatomy here. Okay, that's about right. So I would adjust my IR down a little bit. Okay. We have him just stop breathing. Exhalation doesn't matter because we're low enough that we don't need to control the diaphragm for this one. And my right marker's on there. Okay, so that is how you would do the decubes and the cross table lateral rectum.